A slide sheet and limb lifter may be used to assist with placing lower extremities on a sofa or a reclining seated surface. Place the slide sheet under the patient's posterior thigh and buttocks. Encourage the patient to step onto the limb lifter and pull it taut. Place the opposite end of the limb lifter on the patient's upper extremities. Instruct the patient to keep the limb lifter taut and lean back. As the patient leans back, pivot his feet onto the sofa or reclining seated surface. To assist with positioning and mobility, a foam wedge can be a useful aid in the home health setting. With the patient's lower extremities secure, remove the limb lifter and encourage the patient to bend his legs to assist with positioning on the sofa. A slide sheet under the patient's buttocks reduces friction and shearing, allowing the patient to slide on the surface. The limb lifter may also be used to assist with placing a pillow under the patient's lower extremities. Once positioning is complete, remove the slide sheet. Remember, we never leave slide sheets under an unattended patient. The slide sheet and limb lifter may be used to assist the patient back to a seated position. Tuck a slide sheet under the patient's posterior thigh and buttocks. Place the limb lifter on the patient's feet and upper extremities. Instruct the patient to pull the limb lifter taut and bring his trunk forward. As the patient leans forward, slowly pivot his feet from the sofa to the floor. Once sitting upright, remove the limb lifter and encourage the patient to sit unsupported for at least 5 seconds. If desired, a sit-to-sit transfer back to the wheelchair using a slide sheet and seated transfer board may be completed. The foam wedge is reversed, giving the patient the ability to push toward the wheelchair during the transfer.